Hello. Today we're going to be talking about a very interesting topic. We have with us a young client who's sitting with us, and every patient of ours they pose questions. They have a lot of misconceptions of plastic surgery. They may be having myths and mysteries associated with plastic surgery. What we do, some of them know it, some of them don't know it, but generally, our patients, when they have these myths and histories about something, we have to bust that myth. And today, our young client, she has a myth which she feels is there, and she feels wrongly about it, and she's going to be asking that, and we're going to be busting that myth. Over to her. Yeah.
Yeah, so I'm really conscious about my face and skin. And last week, a doctor suggested me to have a Botox because my face is little asymmetric and they make it right. I've promised me that. But still, I had this thing on the back of my mind that Botox is a chemical and it may spoil my face. And I don't think it's the right age to have a Botox. I'm 27 and I still think I'm pretty young for Botox even after reading what's Botox and I read about it, Botox is a protein that helps to paralyze the muscle and correct your face. But still, I have this myth, and I haven't got an answer. What is the right age for Botox? And is Botox a chemical which really helps your face or really spoils your face? So I haven't got this answer, and I've thought, okay, maybe this is not a right age. Let's try in 40s or 35 or above 30s, 40s, like that. And I met this great doctor and he was helping me out through this journey.
Sure. So I think that's a very valid question what she's asked. And now, I mean, as a responsible plastic surgeon wanting to educate our public, it's my responsibility that should answer the question. And you're right, everything which is being used medically has complications, and if not done by the right person, can go wrong. So, first and the foremost thing is going to the right qualified person. And who are the right qualified people using Botox? It is plastic surgeons for all the aesthetic reasons, dermatologists, because they also do a lot of aesthetic work. So when you go to the right qualified person, you're in safe hands. That's number one. So absolutely the safety is maintained. Yes, the second point, what you asked, what you raised is about it's a toxin, but it's prepared from, synthesized from bacteria, and it's been tried and tested, and that is why it's used FDA approved. So FDA in the United States has approved botulinum toxin, so it can be used safely, again by the right qualified people, yeah, and for the right indications. Now, when you go to a qualified plastic surgeon, they use it for specific conditions. Botox typically is used for correcting the lines, the frown lines, the aging lines, the crow's feet, and maybe even the smile. So these are the classic indications for Botox. But there are also a lot of off-label indications where patients might be wanting a Botox. One such indication is, let's say a patient has a prominent masseter. It can be any age after 18. We normally don't like giving Botox younger than 18 because growth happens till the age of 16 to 18 in most patients. So we wait for this age and then we assess the patient. And when they come to us, we ask them to clench their teeth. And when we find that their faces are very squarish and this is contributing to that squarishness, we inject Botox after very carefully analyzing. The difference between a plastic surgeon and somebody else who is not qualified, they will not know where to inject it. So the complications are more. So there's a muscle which is attached to the commissure from the masseter. And if that is paralyzed, the smile can go altered. So which is why you have a doubt. There can be complications, and you can see on YouTube and other sources where you see diamond dozen complications, but you don't know where they have been injected. Who has injected, you don't know. If it's the wrong hands, yes, you will get scared about it. But when you are going to the right person and he's injecting it, he knows where not to inject, you're in safe hands. And similarly, age is never a criteria for Botox. We inject Botox for sweaty armpits. We inject Botox for sweaty hands. It can be a young patient. Okay. People have There's something called as writer's cramps.
Okay.
So you give Botox for that. So when you're giving it for functional reasons like spasticity, a lot of neurologists use it for spasticity. There's something called a cerebral palsy. In cerebral palsy, there is spasticity. So because of spasticity, you need to release a muscle. So a lot of Botox is given in the forearm muscles and in other limbs. So it's not about the age. Botox can be used at any age, but for the right indication. So our message to the public is it's a safe product. That's why it's passed by the FDA and it is used very widely. And it can be used at any age, provided the indication is there. So that's what I wanted to tell. Okay, thanks for this question.
Thank you so much, and I really learned a lot. Like you've told about the injections in the hand, etc. It's also used, which I've never heard about from any doctor before. Yes, thank you for going through this.
Thank you.